I'll give you a scenario. Your scenario is we've got a 22-year-old female that was ejected off of a motorcycle. She's found unresponsive beside the roadway. Okay. So in this case, scene safety VSI, number of patients 1, additional resources. I'm going to request ALS, police and or fire. My mechanism of injury is ejected off of a motorcycle. This time I'm going to go ahead and grab C-spine because I know she may possibly have a head or neck injury. Grab C-spine. I'm going to turn C-spine over to my EMT assist. Later we're going to show you ways to kind of make this flow a little more smoother, but right now we're just separating each one of the parts and pieces for right now. All right, so now we're moving on to the primary assessment. Okay, so my general impression is I have a patient that looks like she's unresponsive. Her mental status, ma'am, can you hear me? Her eyes are closed. She doesn't verbally respond. She doesn't respond to my verbal stimulus. Remember the AVPU. Now I'm going to check for a painful response. The sternum rub, I can do it for you. Sternum rub, the patient does respond to pain. Okay. Now I'm moving to airway, breathing, and circulation. Airway. Remember, open it, clear it, prop it, treat it. This time I'm going to go ahead and get my EMT assist who's holding C-spine to open the airway, or I can do it with the jaw thrust maneuver. I can do it for real. With the jaw thrust maneuver, I'm gonna look, listen, and feel for breathing. The patient appears to be breathing. It is clear, it is adequate. So you're gonna, at this point, you would state what you hear, what you find, okay? All right, patient's airway is open, it's clear, she is breathing. At this time, I would go ahead and insert an oral airway. If the patient accepts, great. If she doesn't, that's fine as well. And I'm now also going to get a pulse oximetry on the patient and determine what her pulse oximetry is for oxygen management. Pulse oximetry in this case, let's make it 89%. So I'm gonna put high flow oxygen by an hour breather on this patient. Okay, so I've covered airway, I've covered breathing. Next is circulation. I'm going to check pulses. I'm going to check for carotid pulse and a radial pulse. I'm checking to see if they're just present. I notice I have pulses in both areas. I also have touched the patient, so I notice her skin color and temperature and condition is pink, warm, and dry. I'm also going to remove our clothing and check for any major bleeding. We're going to do a head-to-toe sweep. And essentially I'm sweeping under the body because I can see the top side. I'm just doing a quick sweep each section of the body, looking to see if I get any blood on my gloves as I'm going down. Check the arms as well. I don't find any bleeding. I am also going to initiate my shock management at this point, which I've already started, which the patient is lying supine. She's already on high flow oxygen. I'm going to also keep her warm. Once I finish my assessment, I'm going to cover her up and keep her warm. And I'm identifying the priority of this patient as a high priority patient because she is unresponsive right now. That's all I know. So she is a load and go or high priority. That's the end of the primary assessment. Secondary assessment. Now I'm going to start with the head. I'm going to do a assessment from head to toe using the acronym DCAP BTLS. Deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, swelling. All right, all those terms are just fancy words for the minimal things I'm looking for when I go through this assessment from head to toe. I'm gonna start with the head. I'm gonna palpate the scalp, DCAP BTLS, and also checking for crepitus, for grading of bones or movement of the skull. I'm also going to palpate the face, the cheeks, the jaw. Okay, I'm going to take a pen light. I'm going to inspect the pupils, see that they react normally or pearl. I'm going to check in the nose, check in the mouth for any broken teeth, any fluid.